Thank you, Mr. Chairman. I just did have one follow-up question. Dr. McKinty, you had brought it to mind, and it's not in regards to the electronic medical records, but going back to Medicare, being able to fill out the compliance forms to be able to get paid. Has it been your experience, maybe in all of your professions, I've talked good family practice doc in my hometown, finally just pretty much quit simply out of frustration from the standpoint that they had moving bars when it came to being able to fill out the forms, make sure they filled in the right dots, and it was constantly changing. Have you ran any analysis in terms of the cost, how much you were spending rather than spending time with patients? You're paying people to be filling out more records when it comes to Medicare?
Well, certainly our costs in general increased significantly to the point where they were about 80% of revenue for our clinical practice. We had other portions of the practice that evened that out to a total overhead cost of about 63%, but that had increased hugely since the earlier part of the 1990s. We've never culled out Medicare specifically to analyze the cost just for Medicare patients, but overall it increased tremendously. We employed, when I started we had one billing person. When I left we had 6. When I started we had one person to do pre-certifications and things like that. When we sold the practice we had one person per physician. So all these things added up over time. I'm
sorry, I apologize for interrupting, but just so that I'm clear on that, it didn't mean that you were seeing more patients, that you were putting out more bills. It was just compliance costs.
Right, just compliance, correct.
Just strictly compliance.
We did have to ramp up volume too because we couldn't
pay for it.
Since we were getting a set fee. There are 2 ways for a private practice to increase income in a set fee market, and that's to see more volume or to add ancillary services. Mm-hmm. You can decrease costs, but quality, the quality of your service suffers to the point where you're not worth going to see.
Dr. Kennett?
Congressman, I would just say that I hope CMS isn't listening, or the Department of Justice, but if we, if on a regular basis a physician actually read all the documents that you're supposed to sign every day, it would add hours to your day. There's no way. You have, reams of documents that you go through every day and you sign your signature on, whether it's home health or, hospice or Medicare, documentation. It's huge, and there's just no way you can actually even read it all.
When I first started in private practice in 1980, there were 3 of us, 3 physicians, and we had 4 people working for us, 2 in the front office, 2 in the back. That was it, and we did just fine. Today, with 4 providers, 3 physicians, 1 nurse practitioner, we have an office manager, 4 people working in the front office, and 4 people working in the back office. So, I mean, realizing we've got 1 more provider than we did 30 years ago, but still, all this regulation and all the things that we need to do, the pre-certification of everything, you just have to have more bodies. You can't get by without them.
Just to give you it's no consolation, but in this country, businesses are paying $1.75 trillion per year on just regulatory compliance. Small businesses are paying $10,685 per employee in regulatory compliance. And we all know there needs to be some regulations, but I think we've certainly seen an overreach and a complexity that is inhibiting the very important work that I know you physicians in particular want to do, and that's to be able to provide quality health care at an affordable price. So